Are you diligently following a low FODMAP diet, but you're frustrated that you're still having symptoms, running to the bathroom, constipation, diarrhea, bloating, and gas? That's what I'm going to chat about today, the top reasons why a low FODMAP diet may not be working for you. So hi everybody, I'm Taylor. I'm one of the nutrition consultants with the Diet versus Disease team. And like I said, today we're going to chat about what are the top reasons why a low FODMAP diet might not be working for you. I get it. You go to the doctor, they recommend a low FODMAP diet. It's confusing and complex. You're diligently following it and it's so frustrating when you're still having symptoms. We do know that up to 75% of individuals will see symptom improvement with a low FODMAP diet. But for those people that it's not working for, I want to go through what those reasons are. So the first is going to be FODMAP stacking. So for those of you who might not know what that means, if we're eating low FODMAP foods, so they're not no FODMAP foods, but low FODMAP foods, and we eat them multiple times a day or frequently, it stacks up to potentially reach our tipping point. Once it reaches that tipping point, we may flare up and develop symptoms. Also why one day we might eat a food and the next meal or the next day we eat it again and we get symptoms. So FODMAP stacking will be often the first reason. Reason number 2 is going to be fiber. And hear me out. I know a lot of the times when you have IBS, you hear eat more fiber, eat more fiber. The amount of fiber is important. Too much and too little can also result in symptoms. But the types of fiber are also going to be important. Soluble, insoluble, gum fibers, and also reducing those fermentable or FODMAPs can sometimes reduce or increase our overall FODMAP amount depending on our typical eating style. And so looking at the types of fibers you're getting are also going to help with your bowel movements and may be potentially why you're not seeing the results you want low FODMAP. The third is our gut-brain axis. So there's a highway of information that's coming back and forth between our brain and our gut. Lots of information. Sometimes there's a bit of a detour or a miscommunication that happens within that pathway. That miscommunication can send extra pain signals and different messages that can impact our gut for sure. And so what's important here are using strategies to help with that miscommunication. Things such as gut-directed therapy or gut-directed hypnotherapy, for example. Reason number 4, gut irritants. Caffeine, alcohol, spicy foods, even foods that are low FODMAP can sometimes irritate our gut and cause symptoms. There might be a bit of overlap with FODMAPs or there might not. These are going to be important factors to watch for different trends and see if it's an impacting factor for you. It's important to note, just because I'm saying they're gut irritants doesn't mean they're for sure an irritant for you. This is going to be really individual and something you'll want to explore for yourself as well. Reason number 6 is going to be our hormones. So thyroid hormones, estrogen, progesterone, our hormones shift throughout the month as well, which is also why sometimes our management strategies need to shift as our hormones do. We often see any hormone imbalances or even conditions such as endometriosis or PCOS have some IBS overlapping or digestive symptoms, and therefore management here can be helpful as well. So hormones is your next one. Numero 8, I think is where I'm at, is SIBO or small intestinal bacteria overgrowth. Whether it's hydrogen, methane, hydrogen sulfide, bacteria overgrowth can sometimes be a contributing factor to why the FODMAP diet may not be working for you. There are important tests, strategies, and treatments that are going to be required here. This also goes aligned with ensuring that prior to starting a low FODMAP diet, lots of these other things are ruled out. Inflammatory bowel, celiac disease, BAM, or bile acid malabsorption are some that we want to double check. Last but definitely not least is food chemical intolerances. So this encompasses salicylate intolerance, amines, glutamines. These type of food chemicals or natural food chemicals, they're naturally occurring in food, can sometimes cause the same symptoms that we may see or overlapping symptoms with FODMAP intolerance, but FODMAPs are not the root of the issue. When we eliminate FODMAPs, we might feel partially better, but just not quite there. And that's because we haven't quite nailed down the correct compound. So food chemical intolerances would be another contributing factor that may be a piece of your puzzle. Okay, so what I want to leave you with is IBS is frustrating. It impacts our life so much, and navigating how to manage our symptoms is super frustrating as well. But I want to give you some motivation and courage to be able to continue to find those management strategies that work for you. And if you're looking for support in finding what pieces of the puzzle are most relevant for you, please comment me below and we'll see what we can do to help support you in finding the pieces of the puzzle that are most important to you so that we can manage your symptoms and you can carry on as symptom-free and as symptom-managed as possible. And that is all for me today. Cheers. This is Taylor, signing off.